Good evening, sir.
Yeah,
So my topic is immunoglobulins. So immunoglobulins or antibody are a form of humoral component of acquired immune system and are produced by B lymphocytes and functions to protect the against the extracellular pathogen. B cell originate from pre or pro B cells which matures to B cells in the bone marrow. Stimulation factors like CD19, 20, 21 are released when B cells are activated, which then convert B cell to plasma cell and memory cell by the process of clonal selection and clonal proliferation. So, to sum up, pre-pro B cells in bone marrow, it matures to B cells. These B cells are stimulated by first A antigen directly by CD79A or 79B, or from T cells by signaling factor CD40, or from complement system by CD22 or CR2. Then there is release of CD19, 20 and 21. It converts B cell to plasma cells and memory cells. Plasma cells secrete the specific antibody, while memory cells are the resting state of stimulated B cells that are involved in rapid and vigorous response to subsequent infection with particular pathogens. So immunoglobulins or antibody are a protein complex which consists of two identical heavy chain and two identical light chain. At the amino end of molecule, there is a binding site highly specific for its antigen known as paratope and is made of variable regions denoted as FAB, while the rest of antibody is a constant region denoted as FC, which is responsible for the interaction of antibody receptors to the neutrophil, macrophage or mast cell to further activate the complement cascade cell. So then I have drawn the diagram of antibody, white fork-shaped antibodies. So interchain or intrachain bond in antibody is a disulfide bond, and this hinge is present between the two constant region of heavy chain, and which it is rich in proline and cysteine. One light chain is made up of one variable plus one constant chain, while one heavy chain is made up of one variable plus three constant in case of IgG, IgA and IgD, or one variable plus four constant in case of IgM and IgE. So there are mainly five types of antibody: IgG or gamma. It is considered as a general purpose antibody and it is highest in the serum concentration, amounting 60 to 80%. It exists in monomeric form and it is a marker of chronic infection. And it is the only antibody which can cross the placenta, sir. There are four subclass of IgG and they are IgG1, IgG2, IgG3 and IgG4. Mechanism of action of IgG is by opsonization and phagocytosis. Second type of antibody is IgM or mu antibody. It is also called as millionaire's antibody due to its large molecular weight. It is considered to be the marker of acute infection and occurs in a pentameric state, sir. Mechanism of action is same as IgG, but it is 500 to 2000 times more potent than IgG. Third antibody is IgA or Ig alpha antibody. It is a mucosal antibody which occurs in dimeric form, also known as antibody paste, as it prevents the adhesion of microbes to the mucosal surface. It is also present in secretions like milk, colostrum, sebum, sweat, saliva, etc. It acts by activating the alternate complement pathway. There are two subclasses of IgA, IgA1 and IgA2. IgA1 is the inactive form and A2 is the active form. Fourth antibody is IgD or delta antibody. Delta antibody's function is still not clear, but it is hypothesized that they are structurally similar to IgG but functionally similar to IgM. It is only known that IgD is present in the mature B cell as an antigen receptor. Fifth antibody is IgE or epsilon. It is a only heat labile antibody which is produced in response to type 1 hypersensitivity reaction which binds to mast cell and eosinophil, causing release of immunogenic mediators like histamine, which act up on helminth and parasites, etc. So now coming on to hypersensitivity reactions. These are immune reaction leading to tissue damage secondary to an exaggerated inflammatory reaction. These reactions may be in response to external antigen or an inappropriate response to a pathogen or individual's own tissue. Hypersensitivity reactions are of four types. Type 1 hypersensitivity reaction are immediate reaction and occur when individual had been sensitized to an antigen by an earlier exposure. In first exposure, IgE specific to antigen is produced and memory for IgE is then held within the plasma cell. Subsequent exposure induces large-scale IgE production, which binds with the mast cell and release of inflammatory mediators in large number is seen. For example, anaphylaxis, asthma or atopy. So anaphylaxis is generally type 1 hypersensitivity reaction that are localized, but if antigen is introduced in a systemic part, anaphylaxis may be seen. Histamine causes smooth muscle contraction, increased vascular permeability and vasodilation. Thus, classical signs of urticarial rash, bronchospasm, facial swelling, and cardiovascular collapse is seen in anaphylaxis. Treatment is adrenaline, which counteract the effect by alpha and beta agonism. While the delayed component of anaphylaxis, which is due to release of leukotrienes and prostaglandins, causes clinical feature which might last up to 24 hours, can be nullified by the use of steroids. Second example of type 1 hypersensitivity reaction is anaphylactoid reaction. It is like anaphylaxis, but here mast cell degranulation is not mediated by IgE, but it is due to dextran starches, fluorescein or radiopaque contrast media. Treatment protocol is same as anaphylaxis only. Third example is atopy. It is due to inheritance in some individuals which have more tendency to produce IgE, thus increasing the chances of any sort of type 1 hypersensitivity reaction. Second type of hypersensitivity reaction is an antibody-mediated immune reaction in which antibody IgG or IgM are directed against the cellular or extracellular matrix antigen, leading to functional loss or cellular damage. Examples are AIHA, that is autoimmune hemolytic anemia, Goodpasture syndrome, Graves' disease, delayed transplant rejection, rheumatic heart disease, myasthenia gravis, and pemphigus vulgaris. Type 3 hypersensitivity reaction are an abnormal formation of immune complexes, that is antigen antibody complex, and that triggers the complement pathway leading to tissue damage. It is seen in cases of serum sickness, SLE, systemic lupus erythematosus, rheumatoid arthritis, farmer's lung, and IgA nephropathy. While type 4 hypersensitivity reaction is a delayed reaction due to stimulation of antigen-specific T cell, and these reactions manifest in 12 hours to many days. Example, multiple sclerosis, granuloma annulare, and Montauk test. Other immunoglobulin associated disorders include selective IgA deficiency and hyper IgE syndrome, also known as Job syndrome or Buckley syndrome. Sir, I have completed. Thank you, sir.
So this is more of an answer for various types of hypersensitivity reaction rather than immunoglobulin themselves. Okay.
Yes.
Of course, immunoglobulins play a major role in all these types of reactions. I do agree. But when the question is about immunoglobulins, I think some more details about the structure and their activities should be mentioned rather than
Okay, sir.
writing about this. To see what function of immunoglobulin. That was the question, isn't it? Just it is mentioned immunoglobulins. So
Yes,
what
sir.
is an immunoglobulin? That is the first definition. Or glycoprotein molecules that are produced by plasma cells in response to an immunogen and functions as antibodies. So immunoglobulins derive their names from the finding that they migrate with so when antibody containing serum is placed in an electrical field. Okay. What is the basic structure of an immunoglobulin? They have heavy and light chains. So they are composed of two identical light chains, which are 23 kilodaltons, and two identical heavy chains, which are 50 to 70 kilodaltons, which are bound together by what is called sulfide disulfide bonds. And these disulfide bonds have between the chain itself, interchain disulfide bonds are there. The heavy and light chains and the two heavy chains are held together by interchain disulfide bonds and by non-covalent interaction. The number of interchain disulfide bond varies among different immunoglobulin molecules. And the second type is intra-chain disulfide bonds. Within each type of polypeptide chain, there are also intra-chain disulfide bonds. So if you see this picture, the inner one which has got a long one, this is usually called the heavy chain, and the smaller one which is on the lateral aspect. So medially you will find the heavy chain, and laterally you will find the light chain, which is only half the distance. So this is interchain disulfide bond. This is binding the two chains here, and this is intrachain, actually intrachain between the heavy and light, and this is connecting the two portions of the heavy chain, which is called the interchain disulfide bonds. What is the purpose of any disulfide bond? What other chemical produced in the body have disulfide bonds? Can you give me another example? The hormone produced in our body?
Insulin.
Insulin. Yes, insulin also has got. So whenever you want to make a protein, a smaller, long protein into a shorter form, this disulfide bond will hold them together to make it a little shorter. So this portion where you have the light chain parallel to a part of the heavy chain, that is called the variable portion of the immunoglobulin, and the bottom portion is called the constant portion. And in the variable portion only you have something like a cup to hold the antigen, which then comes to hold it and then destroy that. So that is called the antigen binding site. So this is the basic structure. All of you should be able to draw in the exam without any difficulty. So medially, first to draw two halves and connect them by disulfide bonds, and then laterally draw only a short portion parallel to the one on the top, and that will be the light chain, and connect them again by intra disulfide bond. This is inter disulfide bond, this is intra disulfide bond. And once you have done that, there are variable and constant regions in amino acid sequence. These are all proteins. As I said in the first definition itself, they are all glycoproteins. So they have amino acids in sequence and may have many different heavy chains and light chains. And it's clear that both heavy and light chains can be divided into two regions, namely the variable region and the constant region. And in light chain, there are 110 amino acids in the variable region, and the constant region account also has 110 amino acids. Whereas heavy chain has got 110 in one portion in the variable region, but in the constant region, they have 330 to 440 amino acids. That is why it becomes heavy. So the constant portion of the heavy chain has got more number of amino acids, whereas all the other areas have the same number of amino acids. And the junction where the uh, two arms of the antibody form a Y, that is called the hinge region. So in the hinge region, because there is some flexibility in the molecule at this point, and there are what are called domains. These three-dimensional images of immunoglobulin molecule, they are not just straight as what you see here. Rather, it is folded into globular regions, each of which contains intra-chain disulfide bond, and these uh, globular portions are called domains. So if you see this picture, you have the same thing in a little expanded fashion. So this is the hinge portion which connects the two arms of the heavy chain. So the hinge is only because the heavy chain is in two portions, whereas the light chain is only one portion at the top. So the heavy portions are connected by what is called the hinge portion, and the disulfide bond is connecting these two hinges, and this makes it more flexible. And this FAB, the fragment for antigen binding, so it is called FAB region, and this is called constant or crystallization region. So it is called FC because it is fragment crystallized, which can be crystallized, which is made up of the heavy chain bottom portion. So the lower arm of the Y, the single arm of the Y is made up of the heavy chain, part of the heavy chain only. So they are called constant domain, variable domain, and heavy chain and light chain. For the color difference, it is there. So all these part names you should be writing in your exam answer for immunoglobulin. What are all the various regions, hinge region and domains, and their light chain domains and heavy chain domains are there, and also some oligosaccharides are there, because I told you it's a glycoprotein. Carbohydrates are attached to the constant heavy chain 2 domain in most immunoglobulins. However, in some cases carbohydrates also may be attached at other locations. And immunoglobulin fragments, structure and function relationship. Immunoglobulin fragments produced by proteolytic digestion have proven useful in elucidating structure and function relationship in immunoglobulins. So the FAB, which is the when immunoglobulin is digested with papain, breaks into immunoglobulin molecules in the hinge region before the HH interaction chain, and produces two identical fragments of that contain light chain with a variable heavy and as a constant heavy chain, all these things, and antigen binding sites are also there. So the FAB stands for fragments with antigen binding site. So that is the reason. And each FAB fragment is a monovalent one, whereas the original molecule was a divalent one. And the combined site of antibody is created by the variable heavy and light chains. As you saw in the earlier picture, that the cup-like thing which is formed by the part of the heavy chain and part of the light chain, which forms the antigen binding site. And the FC portion, which is the bottom portion, again when you break it down with a enzyme called papain, that also fragments, and that has only two heavy chains at the bottom portion. And the effector function of these immunoglobulins is mediated by this part of the molecule. The FC part only causes the effector function, and normally the ability of the antibody to carry out an effector function requires the prior binding of antigen. So once the antigen comes and attaches itself to the antigen binding site, the FC part is stimulated to cause the required effect. And so you can see this picture to understand that. So antigen will come and bind here. So this is called the antigen binding site, FAB, fragment for antigen binding. Once that has been done, this portion, which is made up of the two heavy chain portions, that is stimulated, and all the effects of this antigen antibody reaction is caused only from this portion. Okay? And there occasionally there are what is called FAB2. Treatment of immunoglobulin with pepsin results in cleavage of heavy chain also at the HH interchain disulfide bond, resulting in a fragment that contains both antigen binding sites. This fragment is called FAB2. That is, instead of breaking it at the hinge, separating the top portion and the bottom portion, if you vertically cleave it, then it becomes two portions of the same thing and becomes divalent. And human immunoglobulin classes, they are subdivided into subclasses and types and subtypes. The immunoglobulin classes are in 5 different forms, which all of us know based on the differences in amino acid sequence in the constant region. So it is not the variable region amino acid sequence, but it is the constant region amino acid region, which is of the heavy chains, which decides the type of immunoglobulin. And all immunoglobulins within the given class will have very similar heavy chain constant regions. So they are divided into gamma heavy chains, mu heavy chains, and alpha heavy chains, delta heavy chains, and epsilon. So easy to remember, all the amino acid sequences are based on the heavy chains only, not on the light chains. Of course, there is a classification based on light chain also, which I am going to show a little later. So this is how you classify. This is the heavy chain portion. So that only gives the characteristic for IgA, IgE, IgD, IgM, and all these various things. And the subclass, this is the main class. First classification is this 5 GMADE, or you can remember GAMED, GAMED for easy remember. So 5 types are the main classes. Now there are subclasses under that. Each one IgG can be IG1, IG2, IG3 like that. So the classes of immunoglobulins can be divided into subclasses on small differences in the amino acid sequence in the constant region of the heavy chains. So in this constant region of the heavy, this is variable region, this is constant region as we saw in the earlier picture. So if the amino acid sequence gets varied, it will become like an isoform. It will become like Ig1, Ig2, Ig3 based on the sequence of amino acids. And so the subclasses are, as I said, IgG 1, 2, 3, 4. There are 4 subclasses. For IgA, there are 2 subclasses. And so see the difference here. The IG1, the small, the joint, thin joint varies a little bit. So the amino acid sequence gets variable in these joining heavy chains. So that is how you classify the subclass. And the subtypes or the types which are there can be based on the type of light chain that they have. So based on this light type chain also, you can divide them into amino acid sequence in the constant region of the light chain. We'll be making it as a physiological difference. So that is done by what is called the kappa light chains or lambda light chains. And the immunoglobulin subtypes, lambda subtypes 1, 2, 3 again. Even in the type, there are subtypes. And this is how the subtype is defined. See, this is the small portion, as I told you, which is on the lateral side of the Y, is the light chain. Here you can see. And this yellow portion is the sequence of the hidden surface. So based on the sequence of amino acids on these light chain small portions, you can have this classification. So all the immunoglobulins can be classified based on the heavy chain as IgG, IgA, IgM, IgE, IgD, and based on the light chain, they are divided into kappa light chain and lambda light chain. So this is the major classification that you have to remember. And the nomenclature is given based on the various subtypes, and there is a heterogeneity. Not necessary that only one type of immunoglobulin should be there. It can be there in all types of population of molecules can be there. It's very heterogeneous in nature. And in addition, different immunoglobulin molecules can have different antigen binding properties because of different variable heavy and light chain regions. So that is the beauty of it, that immunoglobulins are multiple in number, and that's how they are able to attack and take the pathogens and try to destroy them. And structure and some of the properties of IgG classes and subclasses again. IgG has got the 7 S immunoglobulin. Subclasses differ in the number of disulfide bonds and length of the hinge region. So the IgG classification, as I told in the earlier, I showed in the earlier picture, the number of disulfide bonds and the length of the hinge region classifies them. And the properties of this are it carry out most of the immunoglobulin molecules. It is the most common and most present in 75% present in the serum, molecular weight of 150 daltons, and is a major intravascular and extravascular immunoglobulin that is present. And as he mentioned, it can the only immunoglobulin that can cross the placenta, crosses the placenta, and transfer is mediated by a receptor on the placental cell. And but not all subclasses. Only IgG can go, but not the subclasses of 1, 2. 2 does not cross the placenta at all. And what is the function of it? It fixes the complement, and not all subclasses can fix. And it binds to cells like macrophages, monocytes, polymorphonuclears, and lymphocytes, and have an Fc receptor for the Fc region of IgG. And again, not all of them will be doing this function. And the consequence of binding to Fc receptors of the polymorphonuclear and monocyte and macrophages makes them to bind the antigen to the better force, and the antibody has prepared the antigen for eating the phagocytic cells. The term opsonin is described to substance that enhances the phagocytosis. So this is the mechanism by which the antigen is destroyed by opsonization. And IgG is a good opsonin, and binding of Ig to Fc receptors and other types of cells results in activation of all the reactions. And IgM structure, it is a major, bigger, most biggest of all the uh, immunoglobulins. And as he mentioned, it's a pentameric structure. You can see 5 Y-like things are bound together, and it has a valency theoretically of 10, and it has an extra domain, and there's another potent covalently bound SS bound, which is called the J chain. Because this is all too much of details, and chain functions polymerization of molecule in a pentamer. Now, what are the properties of this? The third commonest serum immunoglobulin. The first one is IgG. This is the third commonest molecular immunoglobulin. This molecular weight is 900 Dalton. It was first Ig to be made by the fetus, and the first immunoglobulin to be made by virgin B cells when it is stimulated by antigen. And as a consequence of the pentameric structure, IgM is a good complement fixing immunoglobulin. Thus, IgM antibodies are very useful in lysing microorganisms. As we mentioned, it is very useful in acute infections. IgM is the one which protects, and as a consequence of structure, IgM is also good agglutinating immunoglobulin. Thus, IgM antibodies are very good in eliminating the microorganisms from the body. And IgM binds to some cells with the Fc receptors, that is the bottom portion. And IgA is a mainly secretory, found in secretions, and there is also another protein called the secretory piece. And it is sometimes referred to as SIgA. And unlike the remainder of IgA, which is made in plasma cell, the secretory piece is made in epithelial cells. That is the difference between other two, all other immunoglobulins. And the secretory piece of IgA helps to is transported across mucosa and also protects it from degradation by secretions. So you can see here there are two immunoglobulins which are attached together. So it's a dimeric form which is joined by something like a thread. So this is mostly in the secretions, and the second most common. So first common is IgG, second is IgA, and third is IgM. So you can remember GAM, and E and D come last. So GAMD will be a mnemonic to remember that. And Ig is a major class of immunoglobulin in secretions like tear, saliva, colostrum, and mucus. And it's not, it doesn't fix to the complement unless aggregated, and it can bind to some cells like polymorphonuclear cells and lymphocytes. And IgD structure is a monomer. The properties are is found at very low levels in the serum, and it has got primarily found on the B cell surfaces, and does not bind to complement. IgE is a monomer again, and has an extra domain in the constant region. IgE is less common in serum, but binds very tightly to Fc receptors and basophils and mast cells. And because of that, it is involved in allergic reactions. So IgE, you have to remember that it is the main immunoglobulin found in allergic reactions as a consequence of its binding to basophils and mast cells. And binding of the allergen to the IgE on cells results in the release of various pharmacological mediators and producing the symptoms. And IgE also plays a role in parasitic and helminthic diseases, since serum IgE levels rise in parasitic diseases. Measuring IgE levels helpful in diagnosing parasitic infections. The eosinophils have these Fc receptors for IgE, and binding of eosinophils to IgE coated helminths results in killing the parasite. So this is how the IgE is able to help in eliminating the parasitic or helminthic infection. Again, it does not fix to the complement. And so this is the structure. What are the clinical implications of human immunoglobulin classes? IgE that increases in these various conditions like chronic granulomatous infection, hyperimmunization, liver diseases, malnutrition, dysproteinemia, disease associated with hypersensitivity granulomas, etc. And rheumatoid arthritis also, you can find the IgE levels going up. Conditions where it decreases: A gamma globulinemia, lymphoid aplasia, selective IgA and IgG deficiency, Benz-Jones proteinemia, and chronic lymphoblastic leukemia. In all these conditions, IgE level will go down. IgE level increases in Waldenstrom's macroglobulinemia, trypanosomiasis, actinomycosis, so many other diseases, malaria, common diseases at least you remember: malaria, infectious mononucleosis, lupus erythematosus, rheumatoid arthritis. And decreases in again A gamma globulinemia, lymphoproliferative diseases, lymphoid aplasia, and all these conditions. And IgA, it increases in cirrhosis liver, very common condition which we know. In certain stages of collagen as other autoimmune diseases like rheumatoid arthritis, lupus erythematosus, and in chronic infections not based on immunologic deficiencies, there is a condition called IgA myeloma where IgA increases. It decreases in hereditary ataxia telangiectasia and immunodeficiency syndromes and chronic lymphoblastic leukemia. And IgD increases in chronic infections and IgD myelomas. IgE increases in atopic skin diseases such as eczema, hay fever, asthma, anaphylaxis, and IgE myeloma. And that can decrease in A gamma globulinemia. This is one condition, A gamma globulinemia, where most of the immunoglobulins will decrease. And laboratory assessment of immunoglobulins, you can do post-immunization assessment for tetanus toxoid. It is IgA antibodies can be given for tetanus, diphtheria, pneumococcal pulsocrat, polio, and IgA antibodies post-exposure you can see in measles, varicella zoster, and detection of IgM, isohemogglutinin, you can use that for anti-type A blood and anti-type B blood. And the clinical uses of immunoglobulins can be used for immunomodulation therapy. Like drugs, they are prepared from pool of blood donated at blood collection centers and processed through fractionation to separate the protein fraction from the cellular component. The purified immunoglobulin can treat many immunological problems, including antibody deficiencies, severe combined immunodeficiency syndrome disorders, multiple sclerosis, myasthenia gravis, Kawasaki's disease, systemic lupus erythematosus, organ transplantation, and many others. In addition, IV-Ig therapy, which is intravenous immunoglobulin started within 2 weeks from the onset, makes the recovery of Guillain-Barré syndrome patients much faster. So these are all the uses of immunoglobulins. So that's the so by mentioning these points, we are talking more about uh, the immunoglobulins rather than trying to expand the answer, because hypersensitivity itself is a short note question by itself. So by writing too much about hypersensitivity, I think it is a deviation from the actual question about immunoglobulins. So I thought these points, which are not commonly given in many books, may be useful. Want to write the answer for that.
Thank
Okay.
you, sir. Thank
Thank
you,
you
sir.
very much, sir.